simplify it. And I don't know how many doctors have actually sat you down and got into the detail of it. When I was in the UK, it was my job to actually explain everything to the patient in great detail in terms they can understand. That's why I'm taking this time to explain you guys. Basically, medical field ഉണ്ടെങ്കിൽ diabetes is called microangiopathic vasculopathic disorder ആണ് diabetes. It's not the increasing or decreasing of sugar. അതൊരു manifestation ആണ്. What does this complicated word mean? Microangiopathic vasculopathic disorder. It basically means that when we eat sugar, it's a very nice thing. It gives us energy. But when sugar is going, extra sugar that is not being absorbed properly, which happens in diabetes, that extra sugar goes here and goes there and goes here and goes, I mean everywhere. But it most likes and most affects small blood vessels. For microangiopathy means small blood vessels. Vasculopathy means blood vessels damaging disorder. We have two places in the human body where there are small blood vessels. One is the kidney and one is the retina. So retina is a place that is inside the eye. This is our eyeball. Eyeball is very thin, sensitive, very precious, more precious than diamonds. Our layer. Our layer in the cherry blood vessels. Secondly, we have small blood vessels in our kidney. These two organs are diabetes. Damage chance organs. That is why we always have diabetic nephropathy, kidney, and diabetic retinopathy. So today I was not going to check her for diabetic retinopathy. I was just gonna be like a routine test, and I was gonna let Uma go. But I think I'll check for diabetic retinopathy today. Okay? And my objective today is not to scare you, but slightly it is to arrest the things before they happen, and to make you understand why should we take seriously this diabetes thing. Because it can be a very harmless, very easily controlled thing. You know Wasim Akram, the Pakistani, he is type 1 diabetic. Did you know this? Nobody knows this. Why? Because diabetes is something that lets us live a very healthy life. Because of diabetes, we try to control our rations. I have an uncle who is diabetic. He looks more handsome and more fitter than all the normal people because he's always controlling his diet. So he says it's a very good thing that diabetes is there. I mean, for him, he is taking it in a positive manner. So what I mean to tell you is, it can be taken as a positive thing and make our life extraordinarily healthy as compared to other people's lives, or at the same time, it might cause.
I want to take it in that way.
You take it in that way because seriously speaking, I was very happy looking at you. You look like an extremely healthy. So does Jumana. Look like a healthy family. But I was shocked with these numbers. Okay, appo number ko jaane chahiye. Do you have any parties or anything to attend today? Can I dilate your eyes? Okay.
So, but before that, I have to take my blood for PPDs.
Blood is completely fine. You can. She can put a drop in. If she can put a drop in your eyes, and you can live your life as normal. Just kannilla kocha blurring unta. Namukku driving cheya pattulla. It's okay. Yeah, but I will be really worried because I'm not going to dilate you today. But now I'll be worried if I don't dilate her. Okay. Just in dilate it. For my insurance, I'll just see that there is nothing in the eyes. Okay. Alhamdulillah, I'll be very happy. I can sleep peacefully. Or else we have to accordingly manage it early. Okay. We have dilate both actually. T plus, ma'am, do you have BP?
Last time my BP was 130 over 9.
Okay, that's very healthy. T plus 70. Okay, please have a seat outside. I will see you again in 45 minutes. Till that time, you cannot need to wait outside. You can get your other testing done.
Okay.
Thank you. Thank you. Hello. Hello. జయలక్ష్మి కూడా నంబర్ ఇచ్చారా చెప్పండి. రూమ్ కాస్ట్ 50,000 రూపీస్ ఉంటాయండి పర్ మంత్. మీకు ఓకే? నేను యాక్చువల్లీ నేను డాక్టర్ అండి. ఐఎమ్ సీయింగ్ పేషెంట్స్ రైట్ నౌ. నేను ఒక మీకు హాఫ్ అన్ అవర్ తర్వాత కాల్ చేయొచ్చా? అప్పటితో మంచిగా ఉంటుందండి. అదే మీరు చూసుకొని తీసుకోండి, ప్రెషర్ ఏం లేదు. మీరు మీరు చూసుకోండి ఫస్ట్. నేను అట్లా ఏమే పేషెంట్స్కి అట్లా డైరెక్ట్గా ఇవ్వను. మీరు ఫస్ట్ చూడండి, మీకు ఓకే అయితే చెప్పండి, లేకపోతే నాకు ఒక గుజరాత్ నుంచి ఒక ఫ్యామిలీ వస్తుంది. వాళ్ళేమో ఇక్కడ వచ్చే ముందు బుక్ చేయడానికి రెడీ ఉన్నారంట. సో ఎవరు ఫస్ట్ తీసుకుంటే నేను వాళ్ళకి ఇచ్చేస్తానండి. సో మీకు కావాలంటే ఐ జస్ట్ కాల్ యూ ఇన్ హాఫ్ అన్ అవర్. Guys, can you please switch on your videos and your unmute yourself? You guys are at your
Hi,
home?
sir. Good morning.
Good morning. Who is this Mahesh? There is somebody called Mahesh here.
That's Salient.
Annalene. Okay. I thought some boy was trying to enter the class. I was going to scold him. Okay, so let's start the class then. You guys seem to be at your home. So we continue with Papilledema.
Yes, sir.
Can you see my screen?
No.
Dina, where are you?
Yes, sir. In hospital.
Oh, okay. I thought you wear mask even at your home. So sincere. By the way, Dina, I loved your floaters notes. I just have one request, one question I have. Can you change the words here and there so that, I mean, if I copy paste in search and Google, will I get the exact same page where you got it from?
Yeah.
In that case,
Not the exact same page. A few questions were in some website.
Okay, I got it.
Few questions were in some other website. It's not working together.
Okay. Now these days, the thing are getting very, very strong. He's giving you multiple sources. He'll give you 4 pages where you have taken it from. Within 5 minutes, I can get it. Or else, let me see something. Let me try to submit this and see. If it's okay, then it's okay. Otherwise, we'll try to change something. Okay, Sidra, what is foster Kennedy syndrome?
Um,
Don't look without looking at it.
Foster Kennedy syndrome. Yeah, there will be papillary atrophy in one eye. And other eye will be having papilledema.
Which eye will have papilledema, which eye will have atrophy?
The lesion, the side of the lesion will have atrophy, and the other eye
What lesion?
will have papilledema.
What lesion?
Trauma for any tumors.
Okay. The side of the tumor will have
Have atrophy, optic atrophy, and other side will have
very good.
papilledema.
Good answer. What is pseudo-foster Kennedy? Annalene. Annalene. Mahesh, wife of Mahesh. Is Mahesh your husband's name? I hope.
I think she's new.
She's not in the group.
She's there. Can you hear me? Yes.
Okay, Dina.
Yes, yes, I'm ready.
Extra.
Hello?
What
Yes,
is
we can hear
pseudo?
you. I'm ready.
What is pseudo-foster Kennedy?
The pseudo-foster Kennedy syndrome is due to any cause, papilledema and atrophy can come.
Due to any cause, papilledema and atrophy.
Yeah.
Allah. Okay, fine. It's okay. That's a good enough definition. Okay, so having said that, Sidra,
Yes, sir.
what are the causes of papilledema?
Increased cranial pressure
Okay.
can be vascular change.
Are you asking me or telling me?
Inflammation.
Inflammation. Sidra, don't tell anything, okay? Come on. See, raised intracranial pressure.
Congenital conditions. Like if there is any intracranial space occupying tumors.
Madam, കുട്ടിൻ്റെ ഓക്കെ ശരി പേഷ്യനെ വെച്ചോ. സഫ്രീന ശരിയല്ല. എന്താ ബുദ്ധിമുട്ടാണ് സഫ്രീന? ആ എപ്പോൾ മിനിയാണ്. അപ്പോൾ എന്തായിട്ടുണ്ട്? ചോപ്പല്ല. വേദന ആയിട്ടുണ്ടോ? എവിടെയാണ് വേദന? വേദന ബ്ലാക്ക് കളർ ഭാഗത്തിൽ കൃഷ്ണമണി ഇല്ല, അവിടെ വേദന ഉണ്ടോ? സ്റ്റേൻ അവിടേക്ക് കേട്ടോ. എങ്ങനെയാണോ ചെയ്തോ? എന്താ പേരാ? വാട്ട്സ് യുവർ നെയിം? ഗേളാണോ ബോയാണോ? എവിടെ? അല്ല ആ കുടി താഴെ നോക്കൂ. അങ്ങനെ കൂടുതലായിട്ട് പ്രഷറായിട്ട് റബ് ചെയ്യണ്ട. പ്രശ്നമില്ല, എല്ലാ ഓക്കെ ആണ്. വളരെ ചെറിയൊരു മുടിമാണ്, പക്ഷെ അത് കൺജക്റ്റൈവാണെന്ന് വരും, അത് ഓക്കെ. കോർണിയയുടെ കയ്യിലുണ്ടെങ്കിൽ നമുക്കത് ഡേഞ്ചറസ് ആയിട്ടൊരു കണ്ടീഷൻ ആയിരുന്നു. പക്ഷെ അങ്ങനെയല്ല. ഞാനൊരു ഡ്രോപ്സ് എടുത്ത ഒരു ഓൾഫെറ്റ് എടുത്തു, അത് ഒരു 2 ആഴ്ച കൊണ്ടിരിക്കുന്നത് ആ പെയിൻ പിന്നീട് മാറും. അതിൻ്റെ വേദന എന്തെങ്കിലും ബാക്കിയുണ്ടെങ്കിൽ എൻ്റെ അടുത്ത് ഒരു മാസം കഴിഞ്ഞിട്ട് നമ്മൾ ഡീറ്റെയിൽ ആയിട്ട് 90% ഒന്നും ബാക്കിയുണ്ടാവും. എന്താണ് കുറുമുള്ള അതിപ്പോൾ സ്റ്റാർട്ട് ആയിട്ടുണ്ടാകുന്നത്. അതിനെ ചൂട് പിടിച്ചാൽ മതി. ചൂട് പിടിച്ചിട്ട് 1 മാസം നോക്കട്ടെ. ചിലപ്പോൾ അവിടെ ഒരു ഓയിൽ കട്ട് ഉണ്ടാവും. അത് ഓയിലിനെ നമ്മൾ മെൽറ്റ് ആക്കണം. ചൂട് പിടിക്കുമ്പോൾ തന്നെ മെൽറ്റായിട്ട് അബ്സോർബ് ആവാൻ ചാൻസ്. ഇപ്പോൾ പ്രധാനമായിട്ട് കാര്യം ഇതാണ്. ഇതിൻ്റെ ഡിഫക്റ്റ് ഇതിനെ നമ്മൾ കൺട്രോൾ ആക്കാം. കൺട്രോൾ ആക്കിയിട്ട് 1 മാസം കഴിഞ്ഞിട്ട് അത് ഫിക്സ് ആയില്ലെങ്കിൽ നമ്മൾ നോക്കട്ടെ. ഒരു ലാക്ടേറ്റിൽ ഐ ആണ് 2 times a day for 2 weeks. Refresh clears eye drops 4 times a day for 1 month. ചൂട് ഈ കണ്ണിലെ പിടിച്ചാൽ മതി, കുറുള്ള കണ്ണില് അത് പോകും. ചില ആൾക്കാർക്ക് ഉണ്ട്. ഡാൻഡ്രഫിന്റെ ഇഷ്യൂ ആണോ? താരയുടെ ഇഷ്യൂ ആണ്. താരയുണ്ടല്ലേ, ആ താര ഇഷ്യൂ ഉള്ള ആൾക്കാർക്ക് ഇത് ആവാൻ ചാൻസ് ഉണ്ട്. ഒന്നുകൂടി സ്കിൻ ഡോക്ടറെ അടുത്ത് പോയിട്ട് താരയുടെ ട്രീറ്റ്മെന്റ് ചെയ്താൽ മതി. ആ താര ഇവിടെ പോയിട്ട് അത് ചെയ്തിട്ടുണ്ട്, ഇഷ്യൂ ചെയ്തു. Okay. So, Sidra, tell me the causes of this thing. Okay, Sidra, please tell me the causes for papilledema. I can't hear you. I think you are mute.
Accidental stenosis, intracranial hemorrhage, intracranial infections.
Okay.
Intracranial occupying lesions such as hematoma, tumors. Abscess.
Dina, what is idiopathic intracranial hypertension?
It is poorly understood.
Poorly understood by who? You?
No.
Then?
It's nobody understood that. It's without any specifics.
Yeah, but what is it? What happens? So you have papilledema, but there is no space occupying lesion. So without space occupying lesion to have papilledema is quite strange. That is what nobody understood. It's not that nobody understood intracranial idiopathic hypertension. They don't understand why it is happening like that. Okay. Okay, fine. So. Sidra, do you have Qurana open?
Yes, sir.
Yeah. So, do you want to read?
Yeah.
Okay.
Yes. Which pathogenesis?
Yeah. Second paragraph of the pathogenesis. Yeah.
Till date, Hadley theory is the most accepted one. It states that papilledema develops as a result of stasis of axoplasm in the prelaminar region of the optic disc due to an alteration in the pressure gradient across the lamina cryptosa.
Okay, stop. This is very important. Okay, so another point is important here.
We can see your screen.
Yeah, so it comes very fast. Papilledema comes very quickly, but it can actually resolve within 6 to 8 weeks. How much is 6 to 8 weeks? 2 months.
2 8 weeks. Two.
So it will come within 1 week. It will maximum go within 1 week, and it will reduce within 2 months. So something interesting has been happening in this hospital. I wish you guys would have been here because there are so many great cases that are coming my way. I hope you are able to hear me clearly.
Yes, sir.
Just the other day, I had a very interesting case. Like, you guys tell me what it is. I had a young 24-year-old coming to my OP. He had pain in his eyes, okay, and he had taken tuberculosis treatment 2 months back. What is it? So first of all, for this you have to know that in tuberculosis treatment there is something called as ethambutol. Okay. So ethambutol causes optic neuritis. So this patient was complaining of pain in his eyes. What could be the cause? Like, what should I be worried about?
Check for confusion.
Yeah, very good. So basically, he is having optic neuritis. So I should have checked for color vision. But before color vision, what is more important, or what is more easy that I could have seen?
Pupil reaction.
Okay, pupil reaction, all things are very good, but I could have seen the visual acuity itself. The visual acuity was fine. Okay. Then the second thing I could have seen is the color vision. Girls, sleepy
Yes,
girls.
sir.
I checked his color vision. I checked his visual acuity. Visual acuity was fine. Then color vision also I checked. Color vision also was fine. So I did not worry too much about optic neuritis because vision is fine, means optic nerve is fine. There has to be some visual involvement. Color vision is fine. Definitely, it's not optic neuritis. Okay. So the pain he was having was in this area. So I told him go to ENT and get it checked.
Horizontal.
Huh?
Horizontal eye movement pain.
No, vertical. He had issue in vertical. Not in
Ah,
any
yeah,
eye
vertical.
movement. He had issue in this area. Okay. In the eye region, he had area. So my immediate brain went to optic neuritis. I ruled out everything. Then I told him go to ENT. It looks like sinusitis. So it was sinusitis, and he came back very happy. Now he's taking medications. His pain has gone away. So the way we were thinking on this case is very nice. So yes, yesterday I had another case. Young 17-year-old girl. Hmm? Young 17-year-old girl. She was having seizure. Seizure or fits. She was having convulsant fits. Convulsions she was having. So the doctor sent the patient to me to check for papilledema. Why? Because the seizure can sometimes be due to some intracranial cause, due to some cause in the brain. മുഖ്യമനെ ബ്രെയിനിലെ ചിലപ്പോൾ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ അവർക്ക് സീജർ ആവാൻ ചാൻസസ് ഉണ്ടാവും. ബ്രെയിനിൽ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ നമുക്ക് എങ്ങനെ കാണാം? MRI കാണാം. പക്ഷെ MRI കോസ്റ്റ്ലി ആണ്. MRIന്റെ മുമ്പ് എന്താ ചെയ്യുക? പാപ്പിലെഡിമ നോക്കാം. നമ്മൾ നോക്കില്ലേ? അവിടെ ഇല്ലേ? ICSOL, intracranial space occupying lesions,
Occupying lesions.
is one of the important causes. So intracranial space occupying lesions ഉണ്ടോ ഇല്ല നോക്കാൻ വേണ്ടിയിട്ട് എൻ്റെ അടുത്ത് ഇന്റർനൽ മെഡിസിൻ പേഷ്യൻ്റ് ഇവിടെ അയച്ചിട്ടുണ്ട് പേഷ്യൻ്റ്. അപ്പോൾ ഞാൻ പേഷ്യൻറ്റിനെ കണ്ടിട്ട് പാപ്പിലിഡിമ, ഐ ഡയലറ്റഡ് ദ പേഷ്യൻ്റ്, ഐ സോ ബോത്ത് ഹർ ഐസ്, ഐ സോ ദ ഡിസ്ക്, ഐ സോ ദ മാർജിൻസ്, there was no sense of papilledema. Okay, and I said no sense of papilledema. I felt very happy. If you guys would have been here, we would have cracked this case like this. Okay, so this is, I'm getting very very good cases. The other day I got another case. I went to emergency department where I had a patient who had hot oil injury. Hot oil injury in the eyes, and she had I was afraid of corneal keratitis. Okay, thermal keratitis. Basically, the whole cornea could have been melted, stromal melt also. So, but I checked, she only had something in the conjunctiva and near the eyelids, and she was safe. So I did the staining, and I took that portable ophthalmoscope with me, and it was very nice. So very good cases I'm getting. Very nice cases I'm getting. Wish you guys were here. We could have seen so many cases together. So I'm actually now planning to start practicing on my field evaluation, pupil examination, all these things. Okay, field evaluation, this thing, field evaluation and pupil examination and motility examination, all those things. So sad. This hospital is just 1 hour away, by the way. If anybody is ever interested, one of the days, just let me know. All you girls can come over, or one of you can come. Either way, I can plan something. Okay, but let me know beforehand. So yeah, what I'm trying to say is there is a lot of use for what we are studying. It is useless a lot. Yeah. So let's continue.
Pathogens. So pathogenesis is that.
Pathogenesis is done. Evolution is done. What is shukuru? Leave out. ഞാൻ ആസ്കർ കുട്ടക്കൾക്ക് ഞാൻ പോകണം. ആസ്കർ കുട്ടക്കലാണ്. കൊട്ടക്കലുള്ള ഒരു ആസ്കറാണ്. ഞാൻ അവിടെ പോകണം. ഷുഡ് ഐ ലീവ് ഫ്രം ഇവിടെ എൻ്റെ പകരം മേ ബി എൻ്റെ വൈഫ് വരും. അത് കുറച്ച് ദൂരമില്ല നോക്കട്ടെ. അല്ലെങ്കിൽ ഞാൻ വൈഫിനെ എൻ്റെ പോലെ വിളിക്ക് പോകണം വിചാരിച്ചിട്ടുണ്ട്. നോക്കട്ടെ. ശരി. So yes, girls. Dina, can you please read general features?
Okay. Clinical features. General features. Patients usually present to general physicians with general features of raised intra.
ഒരു a patient is having a head injury. Okay, the baby, old woman, ആരെങ്കിലും ഏതെങ്കിലും ഏജിൻ്റെ പേഷ്യൻറ്റിൻ്റെ ഹെഡ് ഇഞ്ചറി പേഷ്യൻറ്റ്ക്ക് ആയിട്ടുണ്ട്. One patient is only having head injury. One patient is having head injury and vomiting. What is more dangerous?
Head injury and vomiting. Head injury and vomiting.
Yes, head injury and vomiting is very dangerous. That is why whenever we have a head injury, we ask the patient, patients ki vomiting aayo. Why? We don't know.
To rule out brain involvement.
Yes. How? What does vomiting have to do with brain? It is to do with the stomach. Whenever you have vomiting, go to get MRI.
Some pituitary gland.
Where is Fatima? Fatima will go get an MRI. I know. Whenever she gets vomiting. Fatima is yes. അങ്ങനെ ഉണ്ടോ മനെ നമുക്ക് വോമിറ്റിംഗ് ആയാലും നമ്മൾ MRI ചെയ്യാം. No, we don't do that. What happens is, what you told is correct. In the brain, if the pressure is increasing, avade oru CTZ ane oru adundu, oru center undu. If the center is getting stimulated with the pressure, you have vomitings. അപ്പോൾ നമുക്കൊരു ഹിൻ്റാണ് വിതൗട്ട് MRI we can say maybe after head injury there is blood inside the patient's brain. Okay, so headache, nausea, projectile vomiting and diplopia. മോനെ ഡിപ്ലോപ്പിയ എന്താ കാരണമുണ്ട് ഇവിടെ? അനിലിൻ is shy. She doesn't have a beautiful bedroom like Sidra. You cannot show us your face. It's okay if you cannot show, it's okay. But you're not feeling well. Oh, are you okay to stay in this class? Okay. Do you want to answer this or should I go to Sidra for this question? Okay, you can rest. Sidra and Dina, both of you, why is there diplopia here? തലയിൻ്റെ പ്രഷർ കൂടുമ്പോഴേ ഡിപ്ലോപ്പിയ എന്താ കാരണം ഇവിടെ എടുത്തിട്ടുണ്ട്. അതിൻ്റെ എന്തെങ്കിലും സംബന്ധമുണ്ടോ? No. ഞാൻ പറയാം. ബേസിക്കലി നമുക്ക് ലാറ്ററൽ റെക്ടസ് പാൽസി ആവും ഇൻട്രാക്രേനിയൽ പ്രഷർ കൂടുമ്പോഴേ. You should take a marker and write on your forehead. It is that important. It's nowhere like EOG is best disease. I told you a few things, right? Color vision with optic neuritis. അതുപോലെ തന്നെ diplopia or lateral rectus palsy. Intracranial pressure കൂടെങ്കിൽ diplopia due to lateral rectus palsy ഉണ്ടാവും. വെറുതെ diplopia പറയണ്ട. Okay? I hope you guys are getting me. അതിൻ്റെ കാരണം എന്താണ് ഞാൻ പറഞ്ഞു തരാം. ഇതാണ് നമ്മളുടെ ബ്രെയിൻ. ഓക്കെ, യെസ് ഗേൾസ്, ഇത് നമ്മളുടെ ബ്രെയിൻ ആണ് മോനെ. ഓക്കെ, ഇത് നമ്മളുടെ ബ്രെയിൻ ആണ്. ബ്രെയിനിൻ്റെ താഴെ ഒരു സ്കല്ലാണ്. ഒബ്വിയസ്ലി ഇത് സ്കൽ കവറിംഗ് ദ ബ്രെയിൻ. യെസ്, ആ സ്കല്ലിൻ്റെ താഴെ ഭാഗത്തിൽ ഒരു ഓപ്പണിംഗ് ആണ്. ഓക്കെ, behind. From there, from the stem, brain stem, the sixth nerve, abducens nerve, പുറത്തിലേക്ക് വന്നിട്ടുണ്ട്. ഓക്കെ, അവിടെ ചെറിയ ഓപ്പണിംഗ് ഉണ്ട്. പുറത്തിലേക്ക് വന്നിട്ട് അത് ലാറ്ററൽ റെക്ടസ് മസിലേക്ക് പോയിട്ട് സപ്ലൈ ചെയ്തിട്ടുണ്ട്. ഓക്കെ, വാട്ട് ഹാപ്പൻസ് വെൻ ദ ബ്രെയിൻ ഈസ് ഹാവിങ് പ്രഷർ ഇൻക്രീസസ്, ആ നെർവ് ഇല്ലേ അതിങ്ങനെ ബ്ലോക്ക് ആവും. അത് സ്കല്ലിൻ്റെ മേലെ പോയിട്ട് ഇങ്ങനെ ഇറ്റ് വിൽ ഗോ ആൻഡ് കംപ്രസ് ദ നെർവ്. Okay, not okay. മനസ്സിലായിട്ടില്ല? മനസ്സിലായില്ല മോനെ? That lateral rectus nerve is between the skull and the brain. ഇത്ര സ്പേസിൽ ആ നെർവ് ഉണ്ട്. ഇങ്ങനെ ബ്രെയിൻ കംപ്രസ് ആയാലേ ആ നെർവ് കംപ്രസ് ആവും. So if somebody comes to you with bilateral lateral rectus palsy or unilateral rectus palsy, suddenly you should think of brain. In fact, you will think of brain in all cranial nerve palsies relating to the eye. You think about it. You have third nerve palsy. Suddenly third nerve palsy is there. You will still think about the brain if there is pupil involvement. If pupil is not getting involved, it could be due to diabetes. Am I confusing you guys? ഇതെല്ലാം നമ്മൾ കവർ ചെയ്തില്ല മോനെ. Okay, don't worry. I will not pressure you too much. You guys are doing great so far. Good answers. Okay, don't get demoralized. Now, so diplopia, that is why he has written there. That is the story behind diplopia. Okay? That, yeah, whenever there is ICP increased, intracranial pressure increased, there is compression of the lateral rectus nerve, abducens nerve, and it might cause lateral rectus palsy. Now, patients may give history of recurrent attacks of transient blackout or vision. Oh yeah. This is also, this is very confusing actually. In the early stages, visual acuity and pupillary reactions are fairly normal. Okay.
Yes.
So loss of vision is not a common feature of papilledema. He is also saying something called as amyurosis fugax. Seems like a nice French ice cream name. Amyurosis fugax. But what it really means, you know,
The
right?
transient vision
Okay, can you simplify it?
pattern coming in.
Can you simplify it in normal English? Dina. Yes.
Sudden
Yes.
blackout of vision.
Yes. Suddenly the eyes will become black and it will go back. Will the patient remain blind? No. He will have a blackout and he will go. What is the most common cause of transient blackout of vision in ophthalmology?
PR.
Huh? What? I didn't hear you. I didn't hear your wrong answer. What did you say? Yeah. ഇപ്പോൾ എങ്ങനെയുണ്ട്? Better ആണല്ലേ? Okay. Call the patient this side. ഇപ്പോൾ എങ്ങനെയുണ്ട് ഉമ്മ? കുറവല്ലേ? നല്ലോണം കുറവല്ലേ? ഇതിനോട് ഇവിടെ നോക്കട്ടെ. Can you strain her eyes, please? Strain her right eye. നന്നായിട്ട് മാറിയിട്ടുണ്ട്. നമ്മൾ ഇപ്പോൾ എത്ര പ്രാവശ്യമാണ് ഈ ഡ്രോപ്സ് ഒട്ടിച്ചിട്ടുണ്ട്? 2 മണിക്കൂർ. അതിന് അത്ര ആവശ്യം ഇപ്പോൾ ഉണ്ടാവില്ല. ഇപ്പോൾ ജസ്റ്റ് അതിന് 6 നേരം ആക്കണം കേട്ടോ. 6 നേരം ഒരാഴ്ച, അല്ലെങ്കിൽ ബോട്ടിൽ തീരെ വരും യൂസ് ചെയ്തിട്ട് ബോട്ടിൽ നിർത്തിയാക്കണം. പിന്നെ ഐ ഓയിൻറ്റ്മെൻറ്റ് ഇപ്പോൾ യൂസ് ചെയ്തിട്ടുണ്ടോ? അതിൽ ബുദ്ധിമുട്ടുണ്ടോ? അപ്പോൾ അങ്ങനെയാണെങ്കിൽ അതിൽ ഇനി ഒരു 3 days യൂസ് ചെയ്താൽ മതി. ഓക്കെ, ഒരു 3 ദിവസം ഒരാഴ്ച കഴിഞ്ഞിട്ട് അതിനെ സ്റ്റോപ്പ് ആക്കിയാൽ മതി. ഡ്രോപ്സിന് ഇപ്പോൾ 6 നേരം ആക്കാം. ഓക്കെ, നല്ലപോലെ മാറി നമുക്ക് കാണുന്നുണ്ട്. ഇന്ന് എൻ്റെ അടുത്ത് വരാൻ ആവശ്യം ഉണ്ടാവില്ല. എന്തെങ്കിലും ബുദ്ധിമുട്ടുണ്ടെങ്കിൽ വന്നാൽ മതി. ഓക്കെ, പോയിക്കോ. Okay, so should we do staging? Can you hear me? Can you hear me, girls? No? Can you hear me? Okay. So let's do staging. I'll make your life easy. I'll show you a very good diagram for papilledema. Okay. I can't hear anybody of you guys. I have studied
Yeah.
so much papilledema. I found that image to be the most simplest explanation of how. I don't have the image open here, so I can't really read the image and tell you. I'm just guessing. Okay, I don't remember exactly what is in the image. Just correct me if I'm wrong. Stage two is when you can see 70% of the vessels. I think so. See, there are some vessels near the disc margin, which when papilledema is there, they get obscured, okay, due to severe edema. Initially, in the first stage, you can see all the vessels.
No obscuration.
Yeah, obscuration of vessels, okay. In the first stage, there is no obscuration of vessels. All the vessels can be seen. In stage 2, I think there is
Okay. In
30% of
stage, no major vessel obscuration.
stage 2 is
No major vessel obscuration.
okay. Stage 3 is
Stage 1 obscuration of at least one vessel leaving the disc.
okay. Then stage 4 is
Obscuration of the major vessels on the disc.
and stage 5 is
Obscuration of all vessels on the disc and leaving at the disc.
so instead of doing one vessel, two vessel, three vessel, what you can do is the vessel near the disc getting hidden? Is it getting obscured? Okay,
Okay,
that
okay.
is what is important. If you can somehow find that out, then you're okay.
In first stage, there is not. Second, no major.
Yeah, in first stage, what is zero stage one? What is the important thing about
Stage
stage
1
one?
grayish shaped halo surrounding the disc.
In stage two,
Halo becomes circumferential.
is Fatima with you, Sidra?
Yes.
Hmm. I just I just guessed by your frequent smiling. Okay. Yeah, Fatima even put a smile to my face as well. So yeah. So tell me, stage one is only grayish. Stage two is
Grayish and sparing of the temporal disc margin.
no. Stage two is
Stage 2, halos become circumferential, nasal border elevation,
okay. No.
no major
Stage
vessel.
stage three is one vessel is obscured. Yes.
Yes.
Stage four is two vessels are obscured.
Stage 4, major vessel obstruction.
Okay.
Major
And
vessel
stage five is
obstruction.
atrophy, right?
All vessel leaving the vessel is obscure.
What is the last stage?
All four grades, all features of grades.
No, last stage is stage five.
Yes, sir.
Okay, so now look at the takeaway. Okay, if you read it like Sidra, every single point you will forget it very soon. Okay, you will not remember a single thing. Trust me, you will not remember. It looks so easy when you're looking at the diagram and reading it in English. But if you are like me, 7 months, 8 months, 2 years, 3 years later, also if you want to remember, one takeaway thing I always try to find out in every grading. The takeaway thing here is first two stages are okay. First two stages are okay. From the third stage itself, there is one vessel that is hidden. Fourth stage, there is two vessels hidden. Fifth stage, there is all vessels are hidden and it is completely atrophic. Now, how do we remember the last stage of papilledema as atrophy? Everybody is stuck. Surgery करिए. कॉल आया ना इसके ऊपर. मजिद मैं पेशेंट ना देख रहा हूँ आप खाली मेरे को डायरेक्टली वीडियो भेज दीजिए वीडियो. Yeah. So, grading, did everybody understand or not?
You're on mute, sir.
I'm mute, okay, once again. Did everybody understand grading or no? No? Okay. So honest. The thing is, you have to have obscuration of vessels, girls. See, I'll try to make it simple, okay? Actually, papilledema staging is very important. You cannot skip it. But you cannot remember it also very easily. I'll try to make you remember it very nicely. This is disc, okay? If you are having C-shape edema only, it is stage 1.
Okay.
Are you with me or sleeping?
Yes,
Yes,
yes.
okay.
Yes, sir.
If there is O-shape edema, O-shape, stage 2, okay? O-shape edema plus one vessel obscured, it is stage 3.
Okay.
O-shaped edema plus two vessels obscured, it is stage 4. O-shaped edema plus three vessels obscured. I look like some fish seller. Two fishes with two chickens. So O-shaped edema with three vessels obscured, it is stage
Fine.
5. Now, the thing is, Why are we having more fun in these Zoom classes? We never laughed this much in physical class. So, O edema plus 3 vessels is stage 5. Now, stage 5 is also atrophic stage or the end stage of papilledema. There is atrophy, that means there was long standing papilledema, right?
Long time.
So if you're telling that, if you can see that there is atrophy, then right away say that it looks like a final stage of edema, established papilledema, fully atrophic papilledema. Okay, I hope I'm clear.
Yes.
How easy it is now. I want to hear Fatima's voice. If I don't hear Fatima's confident voice, my day doesn't go well. Where is Fatima?
Yes.
So that is under atrophic papilledema is where light reflex is impaired. The rest of the staging, I am not actually underlining it. There is one more point, Mona. How do you know? Have you ever seen spontaneous venous pulsations? Spontaneous venous pulsation. Does anybody want to Google it?
पूरे साफ करके हर पेशेंट यूज कर रहे थे, हर कस्टमर जो हम देख रहे थे तो पूरे यूज कर रहे, ये पहले हम यूज कर रहे पूरा फिर मैं क्या बोले था चेक कस कस मैं बोला था
Okay, there is something called as spontaneous venous pulsations. Spontaneous venous pulsations is something where in the been saying that much. How much he is writing?
No, I just temporary
Okay.
reaction. I just
Okay, fine. There is whenever we have in the disc. Has Fatima gone to sleep? I can't see her, nor video nor audio, nothing I can see. She's here. She's here. I can see. Yeah, I got her. I got her. I got her. I got you. I got you. So now, in the central retinal vein, sometimes the retinal veins are actually, beating like this. Tick, 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 tick. It's very beautiful. I have seen it once. Only once I have seen it. If you see that, tick, 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 and the patient is having all the signs of papilledema, it's not papilledema. Because if the patient is having this tick, tick, tick beating of the venous pulsations, it can never be papilledema. Okay? So, absence of spontaneous venous pulsations. If you can see venous pulsations, then it's a normal pressure, first of all. Okay?
Is it due to intracranial?
No. If intracranial pressure is there, there will not be any pulsation. First of all, you will not be able to see pulsation in every patient. Okay? But if you do see pulsations, that patient can never have papilledema at that point of time. Okay? I hope I am being clear.
Yes.
I would like to ask Ms. Ghafoor this question. Ms. Ghafoor and Ms. Mashur. What is Dina's name? Fatima. Fatima, Ghafoor and Mashur. Nice group. Now, everybody is within everybody. So, girls,
Yes.
without looking at your Purana textbook, like how Fatima is doing, please try to give me the answer for this staging. Fatima, can you give me the staging for A, B, C, and D? Can you come and look it in my screen? Can you see my screen?
You can come in to sit beside Sidra and give the answer.
Dilate ಆಗೋಣ. Okay. ഒരു 5 minute.
Fatima, can you unmute mane? I'm sorry, don't unmute. You should mute. Why is voice echoing? Okay, it's okay, Fatima. You need not answer. Sidra, Dina, try answering.
Yes, sir. The first A shows it's the early stage.
Late stage or
Third stage.
no mandi for you. Third stage?
This is the third stage.
Why are you saying third stage? I need reason.
Because there is the obstruction.
No, there is no obscuration. There is only one C-shaped. Can you see this? There is only this much edema. Okay, this is normal. This is the more edema is there. Okay, in here.
Button ಎവിടെ ಹೋಗಿ?
In this B, in this C stage, so two obscuration plus O-shaped edema, it could be either be stage 4 or stage 5. Okay, am I making sense? മനസ്സിലാവുന്നുണ്ടോ? Okay, now look at this stage. This is how you are supposed to be identifying the okay, girls.
That is grade 4 of grade 5.
Yeah, grade 5. What is the treatment of papilledema? What is the treatment of papilledema? It is an emergency. You have to immediately hospitalize the patient and send the patient to neurologist. Okay, nothing that we can do. It's not in our hands, but it is 100% in your hands to diagnose papilledema. They will send the patient to you to diagnose the patient. Okay, nice class. We'll have another topic some other time. Okay, are you guys okay to have a class on Sunday? 1 hour class. Okay, fine. I think I got the answer from Fatima's expression. Okay, girls, then I'll talk to you later. Bye.